everyone so tired? Why is everyone so fatigued? Couple things I see that are causing this chronic exhaustion and fatigue. Toxins can disrupt your gut barrier. Or let's say you took a lot of antibiotics as a child, you got sick often, your gut barrier is disrupted already. But there is a sign to me that there is something deeper going on.
I'm Jenny Jones, and today I'm joined by Dr. Sogol Ash, a functional medicine physician and longevity expert. In this episode, we discuss the root causes behind fatigue, hormone imbalances, gut issues, anxiety, inflammation, the key biomarkers everyone should be testing, and how functional medicine takes a different approach to optimizing health and longevity. If you've ever been told your labs are normal but still don't feel your best, this episode is for you. You're listening to the BiohackerBlondie podcast.
All right. So welcome to another episode of the BiohackerBlondie podcast. This is going to be a special one because we're here with Dr. Sogol Ash, and you are functional longevity doctor. You are doing all the things to help people heal and get to the root cause. And you deal with so many chronic issues and kind of a very broad range. You see so many deficiencies and lab works, and you're doing it all. So thank you so much for coming on the podcast. And if anyone who doesn't know, Dr. Sogol, she is based in Los Angeles. You're a functional medicine doctor, longevity expert, and one of the most sought after root cause physicians in the country. So you went to you have your master's in global medicine from USK Keck School of Medicine and doctorate from, how do you say that, Bastyr University, with advanced training through the Institute for Functional Medicine. You're in Forbes, Time, CNBC, Fox News, New York Post. You've been doing it all, and now we're gonna get all into it. So
You have my whole resume on there, huh?
yeah.
Was that AI?
Maybe.
That's what. It's okay. I don't mind if that's what they think of me.
It's good. Yeah, I like it. No, but you are doing so many amazing things. So we're going to get into all the questions that people have that constantly, are the main questions for health issues. So thank you. And I guess let's do a little introduction and then let's get into all the questions so people can maybe find a solution to their health issues.
Well, first of all, I'm so excited to be here with you. I feel like the first time we did a podcast was like ages ago. It was like years ago.
I know.
And so much has changed since then.
Ago?
It was 2 years ago.
Oh my gosh.
Yeah, so much has changed. So I'm so happy to be here with you in person, in the same city.
Yeah.
The same state.
It was Miami and then Austin.
Yeah.
LA. We haven't done New York together.
We haven't done New York together. No, that's next. That's next. But yeah. So I was originally trained as a naturopathic doctor. So my training was in combined Eastern and Western medicine. So I really was trained to look at the person as a whole and treat the root cause. I'm really good at that, is really getting to the bottom of things, of why people are feeling the way they're feeling. I think that right now more than ever, people are asking these questions. They're questioning their doctors. They're asking, why are you only running, a few labs on me? Why are you saying this lab is normal? I don't feel okay. So it's making me more excited because patients are feeling more and more empowered. And that's part of my goal, is to help empower people to ask the right questions.
Yeah.
But yeah, I do all the things in terms of from herbal medicine, homeopathy, nutrition, lifestyle, to regenerative therapies and peptides and stem cells, and kind of bring all of it. And I think that's the beauty of integrative medicine, is that you can bring all these therapies together. It's not just one or the other. And I prescribe medication if it's needed.
Yeah.
Like, if it's really needed, we'll go there. There's a time and a place for that too.
Yeah. I love that now it's becoming more that we need to connect everything together, because it's not just the brain, it's not just the gut, it's not just, the heart and the different organs. It's like they all work together, and you kind of have to look at everything together. So should we get into biomarkers?
Yeah.
Okay.
Yeah, let's get into
it.
it.
So what are the top biomarkers you think that people should be testing?
Okay. I will say, I think everyone should be doing a full functional blood panel. Whether it's like someone like me ordering it, or you just go to Function Health. Function has made it very cheap. This is not sponsored, but they run the same markers I do. I care about the same markers. I would prefer if someone did a full panel like that, because it's very hard. People ask me this all the time. What are the top 5 markers? I want to know your full story, really. But if I had to choose a couple, I would say I really want to know what's going on with your insulin. Just knowing what your blood sugar is, is not enough for me, or your A1C. I want to know how your insulin is working and how those markers go together. So understanding what your blood sugar is, and then your A1C and your insulin, and then the lab does these calculations to understand, like, it kind of gives you a score of like how insulin resistant your cells are. So we do these things early, and we can catch insulin resistance very, very mild and very early on before it ever turns into anything like diabetes.
Yeah. It's very important.
Yeah. So it's going to be hard for me to just say a couple things, but I'll put them out there.
And even, I think that's what's happening when people go to a typical doctor under insurance. They're doing minimal biomarker lab testing. And really, with function, they do over 100. Is that common for you to do over 100?
My basic panel is over 100 biomarkers.
Yeah.
It's literally, we have the same panel. Because most functional medicine doctors, those are we all care about those same markers.
And I think so many people think doing 30 or 40 from their doctor, if that.
It's much less. It's like 20. It's like 18 to 20.
And that's what people know.
And it's so unfortunate. I think that's why, like, getting on these podcasts and speaking and the things that you and I do are so important to share with people.
Because then you can really get to the root cause of things. It's like you can really see what's going on. And if you see other things, you can dive further, which we should also talk about all the other testing you can do.
I'll give you a couple others. But I will say that if your doctor is telling you, like, your labs are normal and you don't feel fine, or you think something is up, you have to question that. You have to follow that.
Yeah.
That is the number one thing I tell people. You have to advocate for yourself, because a normal annual physical you're doing with a PCP, that being normal, first of all, there's something to be said about the ranges. The ranges I use, they're even tighter than function. I have a lot tighter ranges in functional medicine that... so a normal vitamin D level, let's start with vitamin D, can be from like 20 to 100. So if someone can be at 20 or 30 and their doctor says they're normal, is that optimal? So in functional medicine, we're looking for optimal ranges, and those ranges are meant for health optimization, for longevity, for living an optimal life. Yeah. So for me, for instance, vitamin D, I like that to sit around 60 to 90. That is optimal.
I have 80.
Yeah. See, there you go. Yeah, I'm right. And there is, for certain markers, there is too much of a good thing too. Like, you don't want vitamin D toxicity either. Yeah. So I think you have to pay attention to the ranges. So ask someone like me, or you find it online, but ask, what are the proper ranges? Because even if you just did that standard test, well, that still shows something. Those 20 biomarkers can still give you something. It's not giving me much, but there's still some markers there. Yeah. I would say another one that's super important for me is actually testing full hormones. Ask for a full hormone panel. So with the thyroid, most doctors will only check TSH. That tells me nothing. That's your thyroid stimulating hormone. You need to check your free T3, your free T4. So that's actually how much thyroid hormone you're making, and the ratio of those together with your TSH at the very least. And then check your thyroid antibodies. A lot of people they live their whole lives undiagnosed with hypothyroidism or Hashimoto's, when all they had to do was just some blood work.
It's crazy. And the function, I know, is $365. And it can save your life. It can give you back your energy. It can change so much for your everyday health and also your happiness, And
absolutely,
it's shocking that we haven't been doing this for a long time. Yeah. And so many people are doing basic blood work. It's just...
It makes me happy that at least companies like this are making it easier for people to get access. I'll get a lot of clients who do function, and they come to me and they're like, well, now what do I do with this? Yeah. Which, that's great. I think that's what you should be doing. Again, I know it's not cheap to work with functional medicine doctors, but if you can, try to work with someone who can guide you based on those labs. Yeah. On the topic of hormones, do you know about DHEA?
Do I know what?
The marker DHEA.
Yes.
Yeah, we've talked about this before. So a lot of people don't know about DHEA. So I will tell you, I run labs. I'm reading through labs day in and day out with a lot of high performers, a lot of CEOs, a lot of founders, moms, people in perimenopause. I see chronically low DHEA in just about everyone.
Wow.
So think about DHEA. This is this precursor to a lot of your hormones, especially testosterone. But to me, it's telling me that the person is, if it's low, they're burnt out and tired. The body's tired.
Yeah.
We need to replete that.
We're
and
all
then people
tired.
wonder, yeah, everyone's tired. We're burning the candle at both ends. And people, they'll be like, but I'm fine. I feel fine. I'm like, no, I can tell you're not fine based on your labs.
Yeah.
Your DHEA being at like 50 when I need it in like the 300-400s, especially for men, you want it high. Your body's running on nothing. And then you do a ratio with that with cortisol. So when I say hormones, again, this is why you can't just choose like 5 top markers, but do a full hormone panel, a full thyroid panel. Understand your DHEA, understand your cortisol level. At the very least, a blood cortisol level. I can get into a whole, right? Cortisol, I love to do saliva and urine testing because cortisol has a whole, it has like, it's a graph and it follows a curve. And so we can get so nitty gritty, and I can understand like why someone isn't sleeping at night, right? Or why they're waking up at a certain hour at like 3 or 4 in the morning, right? You look at their cortisol curve, and it's just, you're using your saliva and urine. It's super easy.
There's like this new wearable. Have you seen it? And it's supposed to track your hormones like cortisol and everything like through the day. I haven't seen it. It hasn't come out yet.
I wonder how it's doing that.
It hasn't come out yet, but I think they're just about to launch, which I'm like, sign me up.
That's interesting. We'll see.
I'll send it to you.
I think a lot of what I speak on and I educate my patients and clients on, a lot of it is that they're burning their bodies out without realizing it.
AI. Yeah. Like, it's just go, go, go nonstop. I think with everyone, we can't keep up in today's world. Like, people didn't have all this, like, Instagram, social media, AI, now robots, and they're going to take over our job. Can we keep up? And, like, even tech, like, they're all just, like, being vampires, staying up all night.
Even if they're not, though, right? I think there's, like, this one side of the spectrum of us, like, we work really hard. We're traveling all the time. We're speaking, seeing clients. And then there are people that they're just stressed by their lives. Even if they're not working, I see moms that are so stressed out, or just people dealing with, just whatever it is in their life that shows up in their labs too. Yeah. I will see labs shift just from a few months from one stressful event. Yeah. And it's very obvious. And I tell my patients, okay, it's very obvious. This was from the death in your family, or this was from the work stress you just had. And it's okay, we'll recover. But it doesn't mean that you had this drastic thing happen and all of a sudden you need to go on a statin. Yeah. Your cholesterol will absolutely be affected by your life and what's going on in your environment.
I was listening to this podcast about hair, and they were saying they can tell, like, when the gray hair happens or patches during a stressful time. Like, they would always go back to, like, a stressful time, and that's when it started. And then there's a way to, like, kind of replenish in the mitochondria and everything. But
exactly. Yeah. Gray hair, think mitochondria.
I told someone this at the conference and they were laughing at me, and I'm like, no, it's a thing.
It's a thing.
Your hair needs
so think about
energy.
Yeah. I mean, I love to talk about mitochondria.
I know.
But
let's just talk about mitochondria.
Let's just talk about
the whole
mitochondria
time.
all day. But like, that's where we get our energy.
I know. It's the best.
It's the best, right? It's like they make our energy. It's like we have these battery packs. There is no illness you will see that doesn't have an element of mitochondrial dysfunction. Yeah. There's just, especially if you're thinking neurodegenerative diseases, right? And there is so much research on all of this. Yeah. Even the heart, mitochondrial dense organ, like the whole body. And like people they're like, why am I so exhausted? Why am I And that's a whole conversation.
I know. And then you include the toxins, which we get into, because I think that also depletes your energy and your mitochondria.
Yeah. So I think you want, one of the things you're asking is like, why is everyone so tired? Why is everyone so fatigued? Couple things I see that are causing this chronic exhaustion and fatigue. Number one, like we just said, they're burning themselves out. So low DHEA, just low hormones. Okay, let's say your hormones are not doing well.
Not sleeping.
Exactly. Sleep is where we secrete a lot of our hormones. Mm-hmm. People ask me, how do I fix my testosterone? How do I fix my hormones? You have to fix your sleep. I cannot out supplement your depleted sleep routine.
Thank you.
It's not going to happen.
I know.
It will never optimize until we fix your sleep.
It's on the Brian Johnson's level. He's
yes. Jenny now has optimized her sleep to a level I don't know if I will ever achieve.
Because it depleted my hormones, you know, and it really does affect, and that just trickles down to every health issue. If you're not sleeping, you can't recover, you can't function well, your body, it's low immunity, it's low everything.
Sleep is literally where our repair and regeneration happens for ourselves. Our lymphatic system, it's like your brain literally decides what memories and what information to keep.
Yeah.
If you're right. So if you're not sleeping, and a lot of our detox happens. So I'm with you on that one. I think it's a very underrated health status or health signal is sleeping well.
I just did a podcast with Dr. Oliver Zolman, and that's the one thing he mentions. When people can't breathe through their nose and the airway, that just disrupts your whole sleep and your longevity. It's like one of the biggest hacks you can do is also make sure that you have, you know, good flow and good
breathing well.
Yeah.
Yes, I'm so glad you said
so
that.
That's a big issue. And so I think sleep, that's one of the biggest questions I get. People struggling with sleep. They're either waking up in the middle of the night and they look at their Oura ring and it just is nonstop waking up. And it's an issue for so many people. So what do you do to help people kind of sleep better? What do you recommend?
Yeah, so there's a lot to unpack when it comes to sleep. I think it's different for everyone. It does go back to the conversation we just had about cortisol. Cortisol is one of the big ones. So if we can get that cortisol curve right, cortisol needs to be, it kind of goes like this. So you kind of want it high in the morning, and then you want it to spike and then start dropping until nighttime. And then that way your melatonin can rise. Mm-hmm. What I see in a lot of people is either they wake up high and they're just high, like their cortisol just keeps elevating all day.
Yeah.
Right? Or they wake up and they have no cortisol and then it spikes at night and then they can't sleep. So that's one thing, is optimizing your cortisol. So we can use herbs. I love to use a supplement called Cortisol Manager from Integrative Therapeutics. It has like magnolia. It has phosphatidylserine. One of my favorite things when it comes to helping people sleep. Again, we don't want a Band-Aid. We want to work on the root cause.
Yeah.
So, but while we're working on that, I'm going to give them some tools to help them sleep, because if they don't feel well enough to do my protocol, right, they need to have the energy. Yeah. They need to sleep and have energy to even implement the protocol that I'm giving them. Mm-hmm. So using things like magnolia, phosphatidylserine, wonderful. I love glycine and magnesium glycinate together, glycine, taurine, all of these kind of help induce a deeper
do like
sleep.
The taurine?
I like taurine. I love
My friend
taurine.
Casey says she does the magnesium glycinate, the glycine, and then the taurine. Yeah. And she's like, my HRV is up. She has like 95 sleep score.
Yeah.
Like insane. Okay.
That trio stack. Yeah. And now, people are adding apigenin. It's like a new longevity molecule. It's made from chamomile, but again, chamomile extract, it's calming. It has sedative properties. So even just drinking like a nighttime ritual, as cliche as it sounds, these herbs have very strong properties. Yeah. Chamomile tea. But I wouldn't go straight to melatonin for people. There is so much more you can do, and using amino acids and these things we just talked about, those help induce. So people ask me like, what markers do I care about with sleep? One of my favorites is looking at their deep sleep on their Oura ring.
Oh, nice. Yeah.
I want to see if you're sleeping deeply. Like, I can be traveling and getting maybe 5 or 6 hours, but my Oura ring is like, you slept very deeply. You still slept. I still feel okay the next day because I still got into a deep sleep. Yes, maybe it wasn't enough for me, but I'm still getting the sleep that I needed. Like, nothing is in the red.
Yeah. 2 of my favorite hacks for sleep. Do you ever recommend this to your patients? No caffeine after 12, and I have a happy light in the mornings to set my circadian rhythm, to get my cortisol right when I wake up.
100%. I have a happy light too.
Okay.
I love it. Yes, it's like the cheapest hack.
I know.
10,000 lux light, right?
Yes.
To mimic sunlight, because again, that's how you fix that cortisol curve. That's one of the either please get outside if you can in natural light, and don't wear sunglasses. Let your eyes register that natural light. If you can't, put a happy light on your desk. Yeah. If you have to go straight to your computer, which I really hope you don't, but at least just have the happy light. You're getting ready. You're brushing your teeth.
Waking up at 5 a.m. when there's no sunlight.
When there's no sunlight. There you go. Yes. Jenny wakes up so early. I'm envious of her. I try. I can't get past earlier than 5:30.
I'm just a morning person. Shit. It's my chronotype.
Yeah. But yes, so the caffeine thing is interesting. So I love to run genetics as part of biomarkers. At the very least, I like to do like the 100 biomarker panel and then a genetic blueprint.
I love that.
If you did those two, without doing all the other stuff, I can get so much data from that. Yeah. And I can see how someone metabolizes caffeine.
Yeah.
I metabolize it very fast.
Yeah.
So if I have like a cup of black tea, I'm Persian. We like to have Persian tea at night after dinner.
Oh my gosh.
Right? Some people at that long dinner table will not touch it.
But when you have black tea, I'm curious, do you measure your sleep?
I do. Mine are fine. This isn't for everyone.
Okay.
It's probably going to be even better. Like I won't argue that it's probably going to be better, but I metabolize it so fast. I won't drink like an espresso at night. But I think the 12 p.m. rule doesn't apply to everyone. I think it's a little more nuanced than that. But absolutely, the earlier you stop drinking caffeine, the better.
Yeah.
The less you're going to mess with your hormones because, again, it goes back to cortisol.
Yeah, I think that's a big one.
Caffeine, cortisol, blood sugar, insulin, all these have a very intimate relationship. They're very sensitive.
Yeah. So one question I get a lot from people is constipation. They're like, why am I constipated? Let's talk about how often someone should go to the bathroom and what to do for constipation. So
there is no world where I will say it's okay if you go to the bathroom every 3 days. A lot of, unfortunately, allopathic doctors have been trained to say that that's okay.
Yeah.
You need to be going to the bathroom at the very least once daily.
Yeah.
If not 2 to 3 times a day. So, and some people define constipation as they go once every 7 days.
Yeah. I think it's more common than we know.
Yeah.
No one's really saying, oh, I'm constipated to everyone.
They don't want to say it, but it's a real problem.
It is. And I've heard this for kids too. I've heard that this is an issue a lot with kids.
A lot with kids. I think one of the number one things I see is just the diet.
Yeah.
It's the standard American diet.
Medication too.
Medications absolutely affect the GI system often. Toxins, another one. Toxins. So we can get into this.
Which toxins do you think affect?
All toxins can affect your gut, right?
Yeah.
So chicken or the egg, but right? So toxins can disrupt your gut barrier. Mm-hmm. Or let's say you took a lot of antibiotics as a child. You got sick often. Your gut barrier is disrupted already. And then you add toxins into the mix from you're drinking out of cans or plastic water bottles, or there was a leak in the home and you get exposed to mold. Those toxins can cross this barrier that they weren't supposed to be able to cross. We're supposed to have a really tight gut barrier.
Yeah.
They start crossing, then your immune system starts reacting to it. And then you start having a lot of the other symptoms. Constipation is just one of these.
Yeah.
But I would say there's definitely diet. It's so simple. Some people just are not hydrated enough. I'm just you just need to drink some more water, eat some more fiber. That's the basic part of it.
Yeah.
A lot of people, though, a lot of the population is dealing with SIBO.
Mm-hmm.
I'm sure you see it.
Yeah, it's massive. And gut permeability and autoimmune. It's just I think the pesticides and all the parasites for me, I think the pesticides are really hurting the gut permeability or the gut lining.
100%.
And I'm just seeing this with everyone. And everyone now, this isn't happening in people that are 40, 50, 60. This is happening now in kids. In 20-year-olds and 30-year-olds. And this is an issue because when you have gut permeability, it's joint pain, fatigue, brain fog, all these issues.
Exactly.
So do you think gas bloating is normal? Because I think most people complain about gas bloating and then they just normalize it. And then that's a sign that leads to deeper health issues. So what do you do when someone says, I think I have gas bloating, what should I do?
You have to get to the root cause. We have to understand what is going on deeper in the gut. My favorite test to run is a gut health test, a gut Zoomer test. I use the Vibrant Gut Zoomer.
Okay.
Have you seen this report?
I've seen their sample report, but I haven't done it.
It's one of the, in my opinion, again, none of this is sponsored, but these are just the things I use in practice and I've tried a lot. I think it's one of the most advanced gut health tests right now out there. It gives
Have you done Jonah?
I haven't done Jonah yet. I think they reached out to me and VitaTract.
You gotta try theirs.
I have to try. Yes. Yes. So right now, I just love this report so much because my patients can see it and understand it too. It like will show you your intestinal lining and what your gut barrier. I can go through this lab and show, hey, this is how your gut barrier is supposed to look like, all these tight junctions. And then it shows how it gets leaky and then like when things can leak in and what happens. And I'm like, now your immune system's reacting.
Oh,
and
nice. Yeah.
It's really fun. But I would say you want to get to the root cause. So I wouldn't suggest when it comes to your gut health to mess around and try to fix it on your own, honestly.
Yeah.
Especially because so much links back to the gut. Like in naturopathic medicine, when they didn't know what to do with people, you know, hundreds of years ago or whatever it was, they would just say, treat the gut. You can never go wrong. Because, and we're seeing in more and more research how everything starts in the gut.
Yeah.
Right? Your microbiome, your a lot of the neurotransmitters. I have patients with like severe anxiety.
And it starts within the gut.
And they don't believe me because they're doctors themselves. And I have one patient and she's a friend and she's a nurse practitioner. She's very smart. And for 2 years, I'm like, let me test your gut. And her anxiety got so bad that we did it. Lo and behold, all these markers are off. All these ratios are off of her neurotransmitters that is really affecting her mood on the daily.
Wow.
And even in this test, I can see if you're recirculating toxic estrogen, which will make women and men, but feel terrible.
Yeah.
So I just think like the value of biomarker testing, even if you did this test once, you know, or some of these tests are just talking to someone. Because sure, if you have gas and be like, sure, take some of this herb, take some fennel, take some chamomile, do some DGL, but there is a sign to me that there is something deeper going on.
Yeah. I think the stool test, DNA, and a full like blood panel is like the ultimate, you know, spend, I don't know how much, $1,000.
Yeah.
And you will get to most of your health issues. And the stool test, which I love, is because it's such a personal thing, right? Yeah. Like akromansia, some people have high levels, some people have low levels. Your supplements should almost be based off of your stool test. And you can really find out which probiotics you need based off of your stool test as well. Exactly. So do you do a lot of specific probiotics based off of their stool test? So what do you recommend if you see leaky gut and things going on in the stool?
Yeah. So if we see like the stool test, like I just want to explain, it can show us your whole microbiome or like a really nice snapshot of your microbiome. You want to have a good balance. But what we see a lot is that some strains are overgrowing, some strains are undergrowing. You'd be surprised how many people I see that have just like no lactobacillus or no bifido, which are two of the most important strains. So we personalize probiotics for sure, but if I see leaky gut, which I see in just about everyone, well, to me, what's causing that leaky gut first? Yeah. Again, you have to go even deeper. Yeah. Right? Because if I just treat your gut, but let's say there's mold in your body or your body's full of heavy metals or toxins that are affecting your gut, then it's just going to keep repeating itself.
Yeah, exactly.
So I always go a layer deeper. Yeah. So if I see that, I will try to find a root cause. Sometimes it's just their lifestyle. It's just food, antibiotics, all those things. Pesticides. But often, pesticides, their right? Food. Yeah. Or, they're not filtering their water. It's just the fried food. We're being bombarded with toxins every day. I just can't. But same. But a very missed thing I see is that people aren't looking for that deeper layer of what's affecting the gut. Like, okay, what allowed this SIBO to happen here? Yeah. Right? Because otherwise it keeps coming back. Yeah. So
everyone wants to supplement first instead of detoxing. And it's really, you need to be detoxing. And I'm sure if you're not like a Mark Hyman or something, you probably have toxins in your body.
Everyone, I see some people who are doing so much to take care of their health, but it's exposure and we can't control all of it. We can do our best to avoid. So I love when it comes to toxins, at the very least, like I think most people should do some sort of liver support, maybe not every day, but at some point, take some liver support because we're being bombarded. Work with a practitioner. Sometimes we add in a binder because if you're releasing toxins, you want to bind them up. Like if you're going in a sauna all the time and you feel terrible, you might want to figure out, okay, maybe I'm releasing a lot of toxins and I'm depleting myself. The leaky gut, some of my favorite things to help heal a leaky gut though, let's just say, Like we're not talking about anything else. I love to use L-glutamine.
Oh, nice.
Helps seal up the barrier, but you want to use it at a higher dose. A lot of products are maybe like 3 grams. You want to take that 3 grams like 3 to 4 times a day. Like you want to go to like at least like 12, 15 grams, like to really, really help heal. I love to use immunoglobulins, right? So a lot of people now know what colostrum is. That helps heal the gut. It also helps with the immune system. 70% of our immune system is in our gut, right? So when we're saying you're getting this joint pain and you're reacting because of your gut, if you're helping modulate the immune system with colostrum, or there's derivatives that are dairy-free too, you're going to help heal the gut.
Yeah.
Using soothing herbs, a lot of what I just said, like the fennel, the chamomile, I love, like we call them like carminative herbs, marshmallow, exactly. Aloe vera. If you have reflux, it's a bigger story.
Yeah.
I love DGL tablets instead of using like Tums or something because that's natural.
Yeah.
Licorice is one of the number 1 herbs for the gut.
What's the one supplement that stinks really
Glutathione?
bad? No, it's a certain bacteria.
I'm trying to think.
Bifidobacterium.
If you're just taking like Bifido, that on its own can.
Okay.
I usually use more blends, so I'm not 100% sure exactly which one you're talking about.
Okay, I'll put in the show notes.
Yeah.
Because that's another one really known to like kind of heal the gut, and it has a horrible egg smell, like a rotten egg.
Yeah, I don't care what I'm like. I tell my patients, I'm like, you just got to deal with this. like I use a glutathione spray for them, the Topic-Glutarol, like the topical one, transdermal. I love them. They're like, it smells terrible, but I feel so good, so they keep using it.
Well, I'm glad they're doing the protocol because I'm sure that's a struggle.
It is. I think when people you get them to start feeling better even a little bit, you got to get people to buy in.
Yeah.
You know, I'm dealing with like high profile people. How do I get them to buy in? That's where I like to, first you explain. You have to explain what's going on and show them you know what's going on. But don't overwhelm people. I think what a lot of even functional medicine doctors do, I get people coming to me from other functional medicine doctors and like, all they do is throw 20 supplements at me at a time. And not everyone can handle that. Maybe some people like you and I can handle taking a lot of supplements, but you have to meet your patient where they're at. You got to get them to buy in, like build on the protocol slowly.
Yeah. What do you do? I know a big thing that people always have an issue is joint pain. Is that's a common question?
Very common.
And what do you think is the root of this joint pain?
Okay. Couple things there. So I will say genetics can play a big role in that.
Okay.
So, and I have this cluster of genetics, which is one reason I got into this medicine. So people have these genetics where it makes us more prone to, let's say, soft tissue injuries. There's methylation issues. There's quarter of the population that just doesn't detox mold and toxins as easily. So we're more susceptible to things like mold. So the joint pain can be coming from a couple of things. Toxins. Number 1 is what I see. Autoimmune tendencies in the body, but it goes back to the gut. A lot of it goes to the gut because if that leaky gut, again, your immune system is reacting to things, you're going to feel it in your joints. There's a number of things, but usually I see these things go together. It's toxins, gut health, and genetics.
Okay.
Together when it comes to joint pain, because they will go to all the chiropractors, they'll do all these things, and
it's not getting to
they
the
don't
root.
feel better. You have to modulate the immune system for that. You have to modulate the immune system. And when I say modulate, it means if an immune system is like overactive, like with a lot of autoimmune issues, let's say, you might want to tamper it down. Sometimes it's underactive. If the gut is so wrecked, the immune system's just like worn out.
Yeah.
Right? Then you want to stimulate it a little bit. But that's one of the first places I start. And that's how I get people feeling better quicker is you can bring in a peptide. Like I bring in thymosin alpha 1 whenever there's joint pain or autoimmunity most of the time to help bring down that inflammation. And help modulate the system, because in the end, all that joint, it's inflamed. The body's very inflamed.
Yeah. I think that's the issue though, is just people want to go to a peptide or an injection or a chiropractor and go kind of from the outside and not really see what's causing that joint pain.
You have to be doing it at the same time.
Yeah.
You have to. I'm not going to get the same benefit out of the peptide I give my patients if I'm not working on the deeper root causes. But I use them as a tool to help, because a lot of these peptides, they're beautiful. They really help, they really do wonderful things for the immune system, for inflammation, for just kind of, sometimes you have to get the system a little calmer first.
Yeah.
Before the person can, again, like have the energy to heal.
Yeah.
Like while I can't even, I see such complex cases where people that come in so inflamed and they're dealing with mast cell, MCAS, and they have autoimmune stuff and their gut is right. They have like the laundry list. How can I start healing them? I have to first calm the body a little bit.
Yeah. And get to the root cause. I think a lot of people are using peptides, not doing the blood work, not figuring out. They're like, I'm tired. I'm just going to pump myself up with peptides. Or I have some pain here. I'm just going to pump myself up with peptides. Or even weight loss. It's like, I appreciate these peptides so much. But if you're like not doing the blood work and not doing maybe some DNA and a little stool test or something, you're never going to get to the root, and it's basically putting a Band-Aid, these peptides.
I 100% agree. And again, I'm a big advocate of peptides, but I will say you can't out peptide a depleted system.
Yeah.
If I have a patient in front of me, a CEO that is burnt out, a mom that is exhausted, I can't just give her peptides and expect her system to react and everything is going to get better. No.
Yeah.
But I'm happy to give that at the same time if we're working on the hormones and the cortisol and fixing sleep and fixing the gut. For sure, because also the better your system is operating, the better your foundations of health, the better your body will respond to the peptides. Mm-hmm. And then the other thing is also, I talk a lot about people just getting things online without knowing, like not doing biomarkers or not working with a practitioner. You can upregulate the wrong pathway. Yeah. If you just throw in peptides and you have no idea what they're doing to your body or what's going on underneath, you can absolutely upregulate the wrong pathway.
Yeah. I think even goes for supplements too. Like people will just guess. And I'm like, you don't, I mean, we're the whole peptide space right now is getting so much noise and like, but really supplements as well. Like you can also be overdosing. Like I have to be careful when I supplement with iodine because I don't want to go over. And so you really have to be careful with all your markers. And so I always just say, please test, please see if you have deficiencies. And then I like to test after. Yeah, to make sure I'm not taking too much of something, too much vitamin B or, and so it just, or D. I've had tracking. My levels high before.
Think about it in a business, like you're tracking everything.
Yeah.
Right. You have all these different spreadsheets or all these different trackers of your revenue and your KPIs. Well, like you should be tracking things with your health too. It's the same thing.
Yeah.
And especially if you're using supplements or peptides or a protocol, like labs are, one way to know if things are working. I combine that with how the patient is feeling too.
Yeah.
That's important. But supplements, a lot of them, but overdosing or underdosing, that's the thing. A lot of supplements aren't even at the therapeutic value they need to be at to achieve the goal. So like, it's really important to check and see, okay, what's in this blend? Is that even enough to get the goal I'm trying to achieve?
And some supplements don't even say how much, like, the amount of each ingredient.
I won't use most of those. I want the ones where I know exactly, because then I can dose it out. Maybe you, for a cortisol manager and adrenal support, maybe you only need 1 capsule, but maybe another patient needs 2 to 3 capsules. Same with magnesium, same with, methylated B vitamins. Everyone, because their labs will tell us.
Yeah. What do you think? So peptides are becoming more and more common now. And people are stacking peptides like no other. So people new to this, they take 1 peptide. And then I think when they hear some people taking 5 peptides or 10 peptides a day, they think it's insane. What are your thoughts on this, like stacking peptides?
I think it depends on the person. I'm not against stacking peptides. I think it's if you're creating the right stack. For yourself. I think 10 is excessive. I'm a fan
Dr.
of like
Jonathan Quo. I think he does 10 peptides.
Yeah,
as a doctor.
10 is a lot. I'm guilty of taking, like multiple at a time. I mean, they have different purposes and they don't interact with each other. But if someone is just starting out, how are you going to know which peptide is doing what for you? How do you know? First of all, people can react to peptides.
Yeah.
As wonderful as they are, people can still react just how they can react to a supplement that's pretty good for you and pretty harmless, but everyone can have a different reaction. So I like to introduce things one by one.
Yeah, I love
but
that.
Also, what is the need? Like, that's what I was asked. Like, what are you trying to achieve here? Right? Why do you need 8 peptides? Do you even need them? I love to create stacks, though, based on, like, you know, if we're working on the foundation, like mitochondrial health. I like to introduce people that way first, or just, you know, modulating the immune system. Let's bring down some inflammation first before you go to a growth hormone peptide, like a tesamorelin, a CJC. Can your body even handle that right now? Do we need it? Like, so I think you can play around with different stacks. I like them, but I think it has to be the right stack for where you are in this moment. And like, first use maybe a foundational stack. Then you're targeting mitochondria. Then maybe you're kind of just targeting the immune system or mast cells. You can create a stack around that. I love to stack a lot of peptides with NAD or Niagen with NR, because you're working on the mitochondria at the same time. So I'm not against them. I just think it's how are you putting that stack together? Like, what's the intention behind it?
Yeah. What are your top 5 favorite peptides?
Okay. I've talked a lot about thymosin alpha, obviously one of my favorites. It just does so much.
And what does thymosin alpha 1 do?
So thymosin alpha 1 is an immune modulator.
Okay.
So our thymus gland shrinks as we age. If you know about our immune cells, our T cells, right? So a lot of that's coming from there. So it helps regulate the immune system, helps bring down inflammation. It's being studied now intracellularly for cancer. So people who are dealing with any autoimmune issues, energy, joint pain, any of that thing, those kinds of things. Anyone who's traveling a lot, getting sick often. We use this for moms who are, you know, their kids are bringing home viruses all the time and they can't afford to get sick. So we build up their immune system and we modulate it, and they stop getting sick every week with their kids, or every 2 weeks. KPV, do you know KPV? It's one of my favorites.
Same. Yeah. These are all my favorites.
Yeah. Because again, these are some of the more, they're just calming. They're not stimulating.
Healing.
They're gut healing. Exactly. All of them have some sort of impact, a lot of them on the gut. But KPVs, yes, gut healing, mast cells. A lot of people, everyone's talking about histamine. Yeah. And we can get into, I think histamine's trending on TikTok right now.
Yeah.
It's a lot of what I deal with. And I'm like, oh my God. KPV is one of my favorites for calming mast cells and histamine down. Supporting the gut, leaky gut, also calming down overall inflammation. Let's see. I like to use mitochondrial ones. So MOTS-C helps work on the mitochondria with SS31. That's a nice stack for mitochondria. And some of them go really well together. And that so helps you do with want energy. Exactly. Energy, helping kind of like get rid of a lot of oxidative stress. A lot of our issues are just that. So think about oxidative stress as like, we have stress, like we're mentally stressed, but our cells get stressed. And they don't look like these beautiful, healthy cells anymore. They're stressed out and they're kind of like ugly. And a lot of these peptides help get rid of that oxidative stress. And then let's see, one more. Yeah. I like the BPC TB combo. Like, that's OG. BPC's been around for so long. It's literally called body protection compound. Yeah. So I do think I see wonderful results with it. It is angiogenic with BPC, so I'm careful about who takes that. Yeah. Because it can create, new blood vessels. So we're careful, but for tissue regeneration, for gut health, for overall healing, and it's wonderful.
Yeah. I think another favorite of mine is tesamorelin. And then I've done it with the ipamorelin, which I love. So that's another favorite of mine. So let's talk about histamine then, because that's probably a big health issue that most people have. And this new thing called mast cell activation, because it wasn't even a thing probably 10 years ago.
Yeah. I would say, like, when I was in my training, like, still like 5 years ago, like we were seeing mast cell, but it was not, nobody knew about it. Yeah. It was not a thing like it is right now. I think people are just coming to the realization.
So what is mast cell?
So our mast cells, think of like, kind of like, they're the things that respond to like allergies, like an allergen, right? They release histamine. Okay. So we have histamine, we have leukotriene, these things that respond to these allergens, toxins, let's say, also a lot of different things. And that's what makes you, let's say, break out into a rash or get red, start itching. But what I'm seeing right now is that the mast cells are just chronically activated. Wow. So people are releasing histamine nonstop.
Wow.
And that's why they feel better from things like Allegra or Pepsid, because those kind of help calm that response down. But yeah, mast cell activation, it's complex, and not everyone has mast cell activation syndrome, MCAS. Some people just have like histamine intolerance because their gut is wrecked, and you fix the gut and then they can handle histamine better. Or there's a parasite. I've seen this. We do a parasite protocol. All of a sudden, they're not eating like foods and itching right away and breaking out into hives or getting pimples and things. Like, people feel it.
Yeah.
There's a feeling of like, there's often itching, there's heat, there's redness. People can go for a walk and start itching all over.
Wow.
Because the more blood flow you have, you'll release that. They degranulate the mast cells.
Wow.
So sometimes just a workout triggers it for people. The root cause, one of the deepest root causes though, that I don't know if people are talking about enough, is your nervous system. An unstable nervous system, a dysregulated nervous system. I can't help someone with MCAS until I stabilize their nervous system.
How do you do that?
So we know all about, I mean, you know, parasympathetic versus sympathetic, right? Being in rest and digest versus fight or flight. And we're not meant to be in fight or flight all the time. That's a response we've developed for acute danger. But what we see daily today is that everyone is just running in is sympathetic dominant, we call it.
Yeah.
They're just constant fight or flight. And from stress, from work, not sleeping enough, just being constantly active, being on your phone. We weren't meant to get pings nonstop all day, these alarms and things like that. So I have to work to regulate that. So we work a lot on the vagus nerve. The vagus nerve is this nerve, if people don't know, it kind of, like starts up here, right? Goes down, it branches all around, especially into our organs and especially our digestive system.
Yeah.
Right. So you have to start working on regulating that response, whether it's through meditation. You can use vagus nerve devices. I love to refer people for craniosacral therapy.
What is that?
So craniosacral therapy is like a beautiful, beautiful ancient medicine where you're kind of barely touching people, but you're working on the cranium and down to the sacrum here. And you're manipulating cerebrospinal fluid.
Oh,
There's a lot of wisdom and science behind it. It's very gentle.
Not the ganglion, state.
There's a stellate ganglion block. Yeah. I think that's invasive. I've seen it do wonders. I don't go there right away.
Yeah.
Yes, but absolutely. I've seen that do wonders for people because it kind of helps shut off that like fight or flight response. That trauma, you know, a lot of it's also trauma for people.
Yeah.
So it's using the right tools, and for different people, it's different things.
Yeah.
Sometimes they need some EMDR. Sometimes they, you know, ketamine therapy.
Yeah.
But it is a daily practice. It is, you know, doing at the very minimum some form of breath work, or doing the gargling or the humming. So because the vagus nerve kind of starts here, a lot of things that help regulate it have to do with here. So gargling daily, doing humming or singing, you activate that and you help tone that nerve.
Oh, interesting. I didn't think about gargling.
Yeah.
Okay.
Yeah.
I'm going to try that.
Very simple things people can do at home, but you calm down the nervous system, all of a sudden you see the histamine response is calming down too.
Yeah.
So
I feel like you can see that too, like when people are stressed in their relationships or stressed in their job, it shows up on your health, you know, and you can see it. And then when people are just thriving in relationships, thriving in their job, it's just like you get a glow to you and your health is not like, you know.
There's just no denying it. There is no world where living a stressful life is not going to affect your health.
Yeah.
Like I see this every single day, and I see it whether it's in their symptoms and how they look and their labs. I see it on all fronts.
Yeah. And I think that goes hand in hand. It's like your gut, what you're, you know, feeding your cells and putting in your body, and then also like your relationships and everything. So it's kind of like you can inflame from what you're, you know, eating on a daily basis or toxins, and then also you have to do these other things to make sure you're in an environment that's not causing stress as well. Yeah,
like it's not just what you're physically taking in, but also energetically. Like if you're like, there are studies on this. If you're like having, you know, this is what biofeedback is.
Yeah.
So part of what I do also for balancing the nervous system is biofeedback. So you put sensors on people, and in real time you can see what's going on with their heart rate, and we're increasing their HRV because we'll basically help them see what happens when they're in a stressful situation. So we'll ask them to think about a stressful situation or a time in their life, and you'll see what happens to their heart rate.
Yeah.
there is no denying it. But this is the kind of stuff you see. So if you're just having a difficult conversation or people are yelling at you, absolutely it's going to show.
Yeah.
So being mindful of, what you're taking in, not just through your food or toxins, but through the people around you, through your surroundings, your work environment, whatever that is for you. But I think people forget that.
Yeah.
Or you get accustomed to it. You get just so used to like this toxic environment. It's like, well, do you know what that's part of my job is to tell people, hey, like, you might want to think about this environment you're in, or is there something you can do about it? Because it's very obvious, especially like most of the time I see flares in people, there's a stressful event linked to it.
Yeah, I know it really can impact your health. And if it's continuous, you really need to say, is this worth, my health? Because it will destroy your health if you're in a bad relationship or something, So let's talk about anxiety then, because I know this is an issue for probably so many people, and panic attacks. I don't know if you work with clients on a daily basis, but that's on the rise as well. So what do you do for anxiety and panic? And do you recommend medication?
Yeah. So I don't love using like anti-anxiety or antidepressants. Sometimes we will use it as a bridge, like a little bit of Zoloft if really needed. I don't love to go there. It can be hard to get off those meds, but sometimes it's needed. For me, it's finding the root cause. So let's say maybe it's just truly there's usually for some people it's genetics. Some people it's just their gut health. Some people it's their hormones are completely out of whack. Some people there's toxins.
Yeah.
Right? We say leaky gut, leaky brain.
Yeah.
What's leaching into your brain?
Yeah.
So that's not the most scientific way of saying it, but right. So I'll see kids with anxiety or oppositional defiant disorder and ADD, and I'm like, well, okay, let's test their gut, let's test their toxins. We clean it up, we clean out the mold, and all of a sudden they don't have oppositional defiant disorder anymore.
It's crazy. And I don't think a lot of parents think about toxins when they think of their kids. I think kids are more like, they don't have a buildup of toxins. They don't have disease. They're young, they're babies. And so they don't think of looking at these things. But I think
susceptible.
And I think a lot of parents need to do these tests for their kids, and even a stool test. I was just at a wellness event and they have a stool test for kids, which I don't know really the difference, but I was like, yeah, parents should be like testing their kids' stool, because that can really help if they have any health issues like rashes or constipation or something that can really get to the kids' issues.
Absolutely. A lot of skin disorders.
Yeah.
Right. A lot of kids have eczema, and adults.
Yeah.
Eczema, psoriasis. Just there are so many things where you can trace it back to the gut and hormones and the liver.
Yeah.
Optimize those. So when it comes to anxiety, again, we first let's try to find the root cause.
Yeah.
But there are plenty of natural remedies that can help, but it's going to be different for everyone. Phosphatidylserine's another one, again, like I like to use. The one you can take it at night, it can help you sleep, but in the day too, it's calming. L-theanine, right? A lot of like kind of amino acid precursors work on mood. You can do amino acid IVs. There's so much there. With herbs, I think it's a bit more nuanced. Some people don't respond well to sedative herbs. They can knock them out too much, like valerian root and I'm very sensitive to them to them too. It's not a bad thing. It's just I'll probably stray more towards magnesium and other thing and amino acids rather than throw a massive blend of herbs that's going to knock me out. 5-HTP, like let's understand your serotonin, what's going on with your serotonin, especially in your gut.
Yeah.
And those kinds of things, and help balance it out. But there's always a root cause to it. Sometimes there's genetics involved too, and it doesn't mean we can't do anything about it.
Yeah.
I think genetics are really empowering. Running genetic tests, I see people, and when I did mine, I was like, oh, everything makes sense now.
I know. Same with me. I was like, okay, all my biomarkers make sense. This is why I struggle with iron. This is why I struggle with this deficiency or something, because it's my genetics. So all my blood work kind of made sense with my DNA.
I have never seen them not go hand in hand.
Yeah.
And to match the patient's lifestyle. And sometimes it doesn't. Sometimes those genes aren't necessarily turned on.
Yeah.
Right? Because it's epigenetics. But we know what to do about it. I can know if someone is at a 50% higher risk of Alzheimer's or cardiovascular disease from their genetics. And then so I know what to look out for them. I know what to give them to help prevent that, or what lifestyle they should really be honing in on.
Yeah. So let's talk about toxins then and what you do, because I think we all know everyone thinks they have parasites. Everyone probably has mold. No. And
I'm seeing it in a lot of people, but yeah, not everyone, maybe let's say almost everyone has a little bit of mold.
Yeah. So I don't know where you want to start first, but say you found parasites and you want to do, detox someone from parasites. What would be kind of the general protocol?
Yeah. So it depends how sensitive the person is. So really, really sensitive patients, the herbs that we use to help, kind of kill off parasites, like the sweet wormwood, you'll see blends of herbs or biocidin. Have you ever used that? I love biocidin. It's a more gentle blend.
Yeah, I have. Yeah,
that can help.
Great.
There's this, I use the Cellcore detox. Like they do like para 1, para 2, para 3. It depends on the person. Someone can take one capsule of one of those and start breaking out and reacting. I like to, before I do any sort of detox, open up the drainage pathways. Whether it's a parasite, a mold, whatever detox, I like to work on the drainage pathways. So you need to be pooping every day.
Yeah.
Like if you're not, you're going to feel terrible when we start detoxing.
Yeah.
So you need to be eliminating well. You need to be sweating. You need to be able, some people can't sweat.
Really?
They're so clogged that, they tell me, they're like, I work out for 2 hours and I don't sweat. I'm like, all right, we got to work on that.
So that's not normal for anyone.
You don't want to not be sweating after a 2-hour workout or sauna, right? So we have to optimize we call them the emunctories, anything where like that something's coming out of you. So like you're sweating it out, like your lymphatics, all of that. We want to optimize all those pathways, your kidneys, your bile. You need to make sure you're moving everything out. Because if I start detoxing you and you're not moving things out properly, you will feel terrible 100%.
Yeah.
And I get calls like that all the time. They're like, oh, I ordered this detox online, this parasite thing, and they feel terrible.
Yeah, yeah.
So it's nuanced. I do, this is one place where I do like a certain medication. It's called Alinea, or nitazoxanide. It's a short protocol, but for some people that are super sensitive to herbs, I actually bring this in for like a short reset, and people feel so much better within a couple days. It's an antiparasitic, but also kind of helps shift the microbiome in the right way, bring down inflammation. It also helps with SIBO a little bit. So, and you see their recovery scores right away shift in their Oura ring.
Wow.
Because the inflammation just came down.
Wow.
So this is where, we use medication and we can use it to our advantage.
Yeah.
There is ivermectin. There are other things as well.
So I was going to ask you,
yeah.
Like, are you a fan of ivermectin?
I am.
Yeah.
I am. Again, within the right context. But I think there are meds that can do wonderful things for us. With the parasites, I really don't recommend people just get an anti-parasite protocol online and start doing it.
Yeah.
It's tough. Like you can react to these things, but some people feel okay too. But I think you either choose the herbal route or choose the medication route, or you can do a dual kind of route if you really want to, like, sometimes there are really tough ones like blastocystis. This is a very tough parasite to get rid of, but we can do it. So we test, we see parasites are notoriously hard to catch though on a stool test. If you're doing one sample, you need at least 3, sometimes even in 3, you don't catch it.
Wow.
But a 3-day, I'm more likely to catch that than not. And I don't always buy it if the test tells me there's no parasites. I'm like, I don't really buy it.
Yeah.
I still treat them anyways and they feel 100 times better. So
wow.
Yeah, we all have some sort of parasite, right? Everywhere we go. You can have parasites like eating a salad these days. Yeah. Right? You don't have to just be eating sushi.
I know.
So
what about Candida?
Yeah. So Candida, it's an overgrowth of Candida albicans. And the Candida loves to feed off of sugar. So a lot of people will have a symptom of it is like they're just craving sugar all the time. They have all these cravings. That's one sign. But Candida can be in the gut. It can be, a lot of women can have like vaginal candidiasis. It could be a lot of different things. Skin. With that, we have, again, certain protocols. I don't love... You
do like an antifungal?
You can do it. Yeah, exactly. Antifungal herbs. Biocidin works on a lot of this. Because it has that blend of like just antimicrobial herbs. So it's generally, I like to use overall antimicrobial herbs when it comes to SIBO, Candida. So think allicin from garlic. Have you heard of that?
No.
Like Alimax. So these things, yeah. So a lot of them are also like extracts that are isolated from certain herbs.
Okay.
So we'll use like olive leaf for certain things, and there's research on different antimicrobials that will match different viruses or different things like Candida versus a different kind of overgrowth or a parasite. So yeah, I like to use different herbs and blends of herbs. Biocidin is just a nice go-to. I like it. But
I don't know why, but I almost forget some of these things because I learn and then I take it and then I forget about it because there's so much out there.
Yeah. For Candida, there's like Candibactin AR, Candibactin BR. So they're blends that a lot of them were naturopathic doctors bringing like these formulas together, but that help kind of kill off. When there's yeast also, that's another one. You want to push out that bad yeast and help crowd it with good yeast. So Saccharomyces boulardii, one of my favorite things. This is a good yeast.
Isn't that the one that smells?
It could. The one I take doesn't necessarily smell, but Saccharo can. Okay. It absolutely can smell depending on the brand.
It might be that one.
Yeah. So you want to crowd out the bad yeast with good yeast. So with Candida, I'll use Saccharomyces boulardii too.
Okay.
There's so many, again, it's personalized to each person.
Yeah.
Depending, because most people who have Candida probably have other things going on. It's usually not, it can be, but it's usually not just that one thing. So we're working on multiple things. When it's SIBO, I'm doing a very specific protocol of like at least 8 to 12 weeks, and I'm giving them high doses of things like garlic and other herbs that are antimicrobial to really make sure we're getting rid of that, because people who take rifaximin, the antibiotic for SIBO, that recurrence rate is so high.
Wow.
And again, you can combine these two with the right practitioner. Sometimes we combine it and we just go at it hard, because if it's been recurrent for 10 years, we're going to have to do some more work. But yeah, we have these awesome natural antimicrobials for a lot of these, but then you have to always do the next phase of repairing. So I like to do phase 1, open the drainage pathways, make sure everything's open, things are flowing. Phase 2 is when we can start killing things once the body's resilient enough. And we can bring peptides in sometimes in phase 1 also to help strengthen and get the body ready for detox. Phase 2, kill. You can use peptides there too. You can use herbs, you can use meds. And then phase 3 is rebuild and repair. Yeah. Really have to focus. And this can take a year to 2 years sometimes.
So I was going to ask you, because I feel like people are probably wondering, okay, I come to you and I have this issue. What is the typical protocol, like step by step, and how long does it take? Because I think people get overwhelmed with the time. They want to heal right away. And this isn't, it's step by step, but it's such an amazing investment, because then you'll feel the best, for years.
I mean, you're an example of that. Yeah. You're like, I feel so, you're like, I feel so amazing. I want everyone to feel this way.
Yeah. And I didn't feel like that at all. I felt the opposite 6 years ago. Yeah. And I struggled with so many health issues, and I reversed all of it, and I feel amazing. And the energy, I thought that was normal back then, was complete fatigue. And now I have energy that I never even knew existed. So it's like the best feeling ever. But what is anyone who wants to come to you, what is the typical?
It can vary. It depends so I tell people, first of all, nature takes its time.
Yeah.
Right. When we want to actually help the body heal naturally and foundationally and build a foundation, that can take time. If I get someone that has come to me with 15 years worth of, or 20 years worth of damage done by medications and antibiotics and, or things that are a gut that's just been destroyed, that's going to take longer than maybe someone who's just kind of dealing with, some constipation, some people can start feeling better within a week, 2 weeks. I think a general rule is nice to say that within 3 months, but again, I like to get people feeling better right away if I can.
Yeah.
Right. That's where we use supplements. We use peptides to our advantage as we're working on the root cause. So it really will depend on what we find and what's going on, and how your genetics. So how your genetics tell me you're going to respond, and how sensitive someone is. So if I'm dealing with someone with Parkinson's, that's going to be a much longer route, or early Alzheimer's, than a 20-year-old with maybe some mild constipation or mild anxiety.
Yeah.
So I think I would say a general rule of thumb, it's let's look at how many layers do you think, or how many years we have to unwind.
Yeah.
And it's not 1 year for every year, but it will take a little bit longer.
Yeah.
But it can really be quick too.
Yeah.
And we just keep building from there. Because again, I have people email me, my patients email, and they're like, just wanted to give you an update. And it's like a couple weeks after they just started their protocol, like 2-3 weeks. And they're like, my energy is up. I have more mental clarity. And we've barely gotten started. So it really will depend. But I would not say that you have to wait a year just to feel better.
Does anyone have regrets not coming to you and working on their health?
No. They're
Like, that's the crazy thing, that so many people have these health issues and they just never take the first step to taking action on their health and you know,
and
working with a functional practitioner.
But even if you don't have a lot or you feel okay, I mean, I guarantee you will find something.
Yeah.
But health optimization, prevention. One of my mentors said always, you know, when we were in school to our patients, she would always say, you don't know how good you can feel.
Yeah, that's me. That's my mom.
That's what, yeah. So many people have normalized how they feel.
Mm-hmm.
I see patients, women with like a ferritin of 6 or 12. They're running on literally fumes and their adrenals are everything. And they're like, I'm okay. And I'm like, do you have any idea how amazing you can feel?
Yeah. Yeah.
Same with men too.
And it's a simple like iron supplement.
Yeah. Or
not
like,
always,
yeah,
but
it's not always. Or like, let's just make some tweaks in your diet. Let's work on your nervous system. Let's fix your gut a little. And you can feel really amazing. Like,
yeah,
our society has really just overly normalized feeling like shit.
Yeah. I don't think most people know what health is or energy. And they've all normalized it. That's the sad part. Like, they think that's normal.
Also, waking up in the morning, I ask my patients, everyone this, do you feel refreshed when you wake up in the morning?
I didn't.
Probably 80% say no.
I don't think I ever woke up refreshed until I started biohacking.
Yeah, like, you should be waking up feeling energized and ready to go.
Yeah.
Like, you don't need to rely on 6 cups of coffee throughout the day. These things are not
energy
normal.
drinks that like, and sugar and carbs and all that. Like, it's just crazy. So, well, this was so good. Oh my gosh. I feel we can go and talk for hours and hours about this. But we have to go. We have to go do some events now.
I think we covered a very good amount, though. We got to touch on a little bit of everything
in an hour. So, well, thank you so much for coming on the podcast. I really appreciate it, and I hope everyone learned all about these things that we can do to make ourselves feel better. So,
thank you for having me.
Thanks.